What do you teach people about recording consent? Again, it's an ongoing process. So at the end of my treatment process, I would normally write that I have received valid consent for treatment. I don't write it down for every single different technique that I use, and I don't get written consent from the patient because my understanding is that it's really not worth the paper it's written on, other than showing good intentions on your part.
Well, the fact that you're writing it in the notes in the first place, that in itself will be the documentation that, or the evidentiary documentation that will be required in a court of law. And you know, the advice that I give when I'm teaching consent, and I don't just do that here in Swansea University, I do that across the UK, and that I said that first of all you have to be satisfied that the patient has got the relevant capacity to be able to make that decision, and the only way that you're going to know that is by giving all of the relevant information and that they have a full understanding of what it is that you're proposing to do. And that is what you need to be writing in your documentation, to say that the patient has understood the intervention that is being proposed. This is the information that I have given in order to do X, Y, Z. The difficulty, I think, with this particular discipline is the fact that you're not working with an actual diagnosis. So you may have differential diagnosis, you may well be having a working diagnosis, for example, which makes it very difficult for you to really clarify what exactly you need to do. Because during treatment, you may have to change. Yes. I mean, I don't know, maybe the osteopath will be able to tell me that, but you may have to change tack depending on what you find when you're examining the patient. And at that point in time, you might have to say to the client or to the patient that actually, you know, although you're complaining of this, now I have found this, and therefore this is what I'm going to do. And that is what you would need to document.
I'm not sure I'm allowed to say this is what I'm going to do. I'd have to say, would you mind if I do this other thing?
Well, or something like that, whichever way. But,
well, I don't know. Jonathan might,
I mean, Jonathan,
might have an opinion on
I
that.
don't know. I don't know.
So many people saying
you can gain consent if you say to a patient, this is what I'm going to do, and the patient says, okay then, or the patient gets onto the couch, you haven't said that. I mean, you'll know the case of Montgomery, but there's a paragraph in Montgomery that I think sums this point up nicely, which is that a doctor's duty is not fulfilled by bombarding a patient with technical information, let alone by routinely asking the patient for a signature on a consent form. It really means nothing in its own right. It adds somewhat to the value of the record, but that is not consent. Consent, as the professor has said, it's a process. The signature at the end of that process might evidence the fact that you've been through the process. It might not. It depends on the patient. It depends on how good you are at communicating. But again, I always tend to advise my clients, if possible, don't just get the patient to say, I consent to the treatment that you've described. Also have something in there that adds a little extra that says, everything's been explained to me. I've had an opportunity to ask questions. I've had an opportunity to think about this, and I consent. And it's very difficult then when they're being cross-examined by the likes of me in a hearing down the line to say that didn't happen. Some people say, of course, well, I signed it, I didn't read it. But the more you've got in that paragraph at the end, the better.